Hey, what's up, everybody? Corey Dion Lewis here. I saw a LinkedIn post a few weeks ago from Dr. Philip Alberti that stopped me in my tracks. And it read, "The more our organizations change their language, the less their communities trust them." And this has been a conversation I have had over the past year with many of my friends. Overnight, organizations scrubbed words like equity and justice from their websites. And look, I get it. Grants are on the line, jobs are on the line, and that's real. But here's what Philip helped me understand. It's not about the words. It's about how we made those changes. Did we talk to our community partners first, or did we just panic and comply? Now, in this conversation, we talk about why speed matters, what health equity for all communities really means, and how we build trust when everything feels like it's falling apart. This one is important. Let's get into it. Here's my conversation with Dr. Philip Alberti from the AAMC Center for Health Justice. Hello, everybody. Thank you for listening to the Healthy Project podcast. I'm your host, Corey Dion Lewis, and I have one today that I've been super excited to record. This started off with a LinkedIn post that I was just snapping my fingers. I was like, oh my gosh, this is what my whole world has been, I feel like. And today I'm joined for the second time on the Healthy Project podcast, Dr. Philip M. Alberti. He's the founding director of the AAMC Center of Health Justice. Philip, thank you so much for being here, man. I really appreciate it.
Oh, thank you for having me back, Corey. Excited to be here.
Yes. So, what started this whole, thing for me? I think you said the more our organizations change their language, the less their communities trust them, and that has been, I'm sure, has kind of been a part of your life the past, I don't know, however long, but it has been a part of my professional life and experience right now. So let's just, I would love to kind of start there and kind of the story behind that into where we're at now.
Sure. There are real reasons that institutions, individuals, organizations are rethinking, reconsidering, busting out that thesaurus, and changing the words, right? Some real existential threats. So I don't want to belittle that reality in 2025. But I think there's another risk that we haven't been so as attuned to, let's say, as to that existential risk of funding and employment, and that is all the good work that we've been doing for years and decades with our community partners in this space of population health and health equity that's so predicated on building trusting relationships. If we kind of unilaterally, if our institutions just change it up, hide the work, rename it, reframe it, let go of folks, that not only imperils the trustworthiness of our organizations, but in my mind, it actually puts at stake all of our population health and health equity work that is founded on those trusting relationships. And it's not just the fact that we change our words or even what we change our words to, but it's how we changed our words. What was that process, right? Were communities engaged in doing that work of exploring the thesaurus? Did we make sure that we all understood what those existential threats are and kind of arrive at a place of understanding together? And so unsurprisingly, given the theme, I always come back to the AAMC Center's Principles of Trustworthiness Toolkit. And the third principle is without action, your organizational pledge is only performance, right? And so that principle is about commitment, and that's about words without action sending a message. And I think this is a riff on that. Maybe it's the flip side, right? So if the actions that we don't take send a message potentially that we're not committed, then the actions that we do take, including actions around our words, can also send that same message.
Exactly. And a lot of the things that you frame are around being I don't want to misquote you, being hyper local. I think you said that a few times. And when we're talking about this change of words, how do community members typically respond to this shift in institutional language, especially around terms like equity, justice, or even racism. What have you heard from both community and professional stakeholders about how these changes affect trust?
So I guess I'll first want to acknowledge that, one community is one community. And then
Mhm.
even within a single community, there's such diversity, right? Whether we're talking
Right.
about a demographic community, a geographic community, a community defined by a shared interest. So I don't know that there's one response, that there's one kind of typical reaction. But I will say that a response that I have heard from all kinds of folks in this ecosystem, community partners, patients, scientists, academics, is really about the speed with which organizations complied, right? Even before they were necessarily asked or quote unquote forced to, right? And as I mentioned earlier, the lack of community engagement in crafting the new language and thinking through those changes and extending the partnerships to these kinds of decisions around the language and framing of the projects and the work. I think I have heard that kind of automatic compliance without that engagement sends a message that underscores that lack of commitment to the work and therefore kind of a lack of respect for the partnership and the communities that we're working with.
Yeah, and can I touch on the speed too as well? If it felt like, and I had a friend of mine say this too, like these words aren't illegal. Like it felt like it happened so fast, and there
Mhm.
was this instant fear of saying certain things, or to some people saying, "Hey, I'm just telling the truth," but now I feel like I can't speak my truth because they're being villainized or whatever. It felt like it was like that, and
Mhm.
it was just like, hey, like you can still say it, like it's not a swear word, but that's the feeling.
Sure, but money's on the table, careers are
Yeah.
on the table,
Hmm.
livelihoods on the table. I mean, I don't like again. We started off. I don't want to minimize the threats. The threats are real, and I
Hmm.
think there is, and I've heard this from community members too. There is a total recognition and understanding from almost all of the community members and patients that I've spoken with and that my colleagues have spoken with. They understand the threats. They understand what's happening. They see it in the news. It's not hidden. And so I
Hmm.
think it's just the missed opportunity to engage community partners on the strategies and tactics on how best to respond to those threats and maintain trustworthiness, even in this kind of existential crisis that we're in.
Yeah, so from what I understand, and I totally agree, it's one, people still got to eat.
Hmm.
Lives are at stake, people's families are people are, hey, I'm never going to tell somebody to say something knowing that it could, whatever that grant is funding their life, or how they live. um but what is that middle ground of still standing up for what you believe in, but also knowing you know what the outcome could be.
That's right. That's exactly right.
Hmm. Many public health and healthcare leaders express genuine concerns, about using these words.
Mhm.
Are there any more? How would you help somebody navigate through kind of this current landscape?
Yeah, and again, I 100% those concerns are genuine. I have them. It's not even. It's also about
Mhm.
personal safety, right? Not just professional safety. It's about personal safety. And so I
Right.
think the field has been impacted in ways obviously bad, but also maybe good and some positive challenges. And so I think the bad impacts are pretty obvious. We've talked about some of those: the cancellation of funding, the firing of entire teams focused on health equity or DEI work more broadly, etc. On the good side, and I say this maybe a little tongue in cheek, we've seen a lot of so-called health equity tourists kind of immediately exit stage left. Right, that
Mm,
these are folks that came on to the health equity movement when there was money, when the topic was hot, kind of
mm.
around COVID,
Yeah, the
and
light
now
was bright.
correct. They jump ship. And so maybe that's not a bad thing. Let's keep the
Mm,
core folks that have been committed to this work around. That said, and I think it's part of my nature, and maybe the nature of many health equity minded folks, to be optimists. I insist on trying to see this moment as one of opportunity, right? So for our folks, you said about kind of navigating. I think the navigation has to start with some real reflection, right? And then responding in ways that can move and build our movement in a different way. And so if I'll say it like this, and I wrote a different paper, not a LinkedIn post, though I love LinkedIn, that kind of makes the case, health equity is, and I think you believe this, and I know I believe this, that's why I'm in this game, health equity
Mm.
benefits all of us, like
Yes.
each and every community. And so if that is true, how can this concept in 2025 be so divisive? Right? Where have we lost the thread? So I think we need to listen very carefully to those individuals and organizations whose values run perpendicular to ours when it comes to population health equity. What are they saying about health equity? What are their misunderstandings and mischaracterizations? And then I think we need to do some really tough introspection to think about how we, in various ways, from our measurement to our messaging to the narratives that we put out there, how have we maybe made their arguments easier for them to make? Right? And so I think this is a moment
Mm.
where we could and must regroup and not lose our values and not lose our partnerships and maintain that core kind of community engaged positionality. But we need to really ask ourselves some tough questions about how we can more effectively make the case that our goal of health equity really does mean all communities are thriving.
Yeah.
We're not there.
Yes, I'm going to link that article in the description of this episode on YouTube and the audio platforms, so those listening and watching be able to get to that. I read the article, and I would love to, if we can, just a little bit, not to go off the
Mhm.
left so much, but I think this is a conversation that a lot of health justice, health equity, people who are advocates, call them, or who say that who are experts or advocates or professionals in the space, um, maybe don't really have the conversation of what it means to be equitable for all, because of um, racial inequities were such the kind of the top priority for a time.
Mhm.
Still are, there are still things that
Mhm.
we are going through right now. But can you talk about how those people who are doing the work, who are um, on the front lines, who really see or envision a different world, more equitable world, um, how do we start to explain ourselves like, hey, this was a priority, but we're not blind to the fact that there are other inequities that need to be taken care of and considered?
Yeah, and let's just double down. Like, we should not lose sight of, water down, minimize racial and ethnic inequities in health
Right.
and the economy. Those are real, and so and that needs to be and continues to be a focus of all of our health equity work. But I think the paper that you referenced is provocatively called "Health Equity Benefits All Communities, Even White Ones," or including white ones. I forget the
Mhm.
word. And I think it was sparked, and it's been something that's been percolating for a while. So there was an editorial back in 2021 written by a former U.S. cabinet member, um, who made two very bold claims about health equity and equity work in general. And the first, or one of them, was just what you said, that our work is racist and exclusionary and discriminatory because, certainly in the wake of COVID and watching brand new racial and ethnic inequities develop right before our eyes, right, there was a real and important need to focus on racial and ethnic inequities in a way that we hadn't before, coupled with the Black Lives Matter movement, et cetera. And so the argument was, you, health equity folks, are discriminatory. You are exclusionary. You are not thinking about all the other populations that could benefit from this work. So that was one argument that really stuck with me. And the other is that we are un-American. And the reason that this individual argued that we are un-American is because, and this is a misunderstanding or a mischaracterization, depending on how generous you want to be, was that we and on the equity team, so to speak, are exclusively like laser-like focused on mandating, their words, not mine, mandating equal outcomes and not focused on equal opportunity. Now, any of us that have spent any time in the health equity space understand kind of that lodestar Centers for Disease Control and Prevention definition of health equity is that we achieve health equity when everyone in all communities have a fair
Mhm.
and just opportunity, right, to attain their highest level of health. Opportunities baked in the definition. But somehow we have not been hitting that note hard enough. And it has allowed that door to open, right? If your viewers might not, your listeners probably can't see me, but I'm a cisgendered white guy, but I'm a gay man, right? And so I came into this work thinking about class-based inequities, thinking about inequities around the LGBTQ community, and there has been long-standing work in the health equity space around economic inequity and sexual orientation or gender identity-related inequities. And so I know that our tent is huge. But again, this mischaracterization of we are only concerned with Black, Brown, and Indigenous folks, that's also not true. So those two kind of, again, misunderstandings or mischaracterizations really stuck with me. And so in thinking about this piece, the article that you mentioned, it was about, well, part of the issue is we haven't translated that goal of health equity into something that is really tangible for everybody. Right? And so we can talk about different ways to do that. What does a fair and just opportunity look like? Right? There's also this really harmful false narrative that exists in our nation, kind of put the health equity piece aside, that we just live in a zero-sum game, that there is a finite pool of resources, whether it's health resources or economic resources, and therefore, if we are really focused on, as this individual kind of mischaracterized, if we are supposedly focused on equal outcomes, that means to lift some groups' outcomes up, some other groups' outcomes have to go down, right? That is not true. There are no losers in a health equity kind of system here. We all can benefit. There are enough resources to go around. But the way that we talk about it, the way that we measure our progress, right, towards health equity is by watching gaps narrow. And if 40% of our society thinks that if gaps narrowing means there are winners and losers, then even our very measurement reinforces this notion that their communities must lose for other communities to gain. And then, to be fair, and I'm guilty of all of these things, right? I don't know that we've engaged. I am a community engaged scientist practitioner by training, by experience in the health department. It's kind of the work that we try to foment out of our Center for Health Justice. I don't know that we as a health equity field have engaged folks that currently don't see themselves in this movement, to understand what their goals are, what their perceptions are, their understandings, and to begin to break that challenging bread together and find common ground. And so I think I try in that article to lay out some different ways that we could think about defining our terms, measuring our progress, and doing that difficult work of engaging across these really large divides that are only growing in 2025.
Yeah, it made me think a lot, Philip. It made me think because, I use the excuse of I'm not talking to that side for my mental health. I can't do it. Right? I can't do it because I felt like there would be it wouldn't be reciprocal. So if it's like, nope, this is where I'm at.
That's right. And I think there's a line in the paper. It's like, we cannot ask, right, our Black and Brown folks to try to build these bridges. It's not safe. You're right. It's too mentally exhausting. It's not okay. And so there is some onus on white health equity champions to begin to do this with our family, our friends, and our neighbors. I have this fantasy not-for-profit organization that I will not use the name that I typically use because I don't want to give one of my brother-in-laws a shout out.
Pocket.
Yeah. Well, let's call it the Daves, right? So I have two brothers-in-law. One's from military background from Texas, the other's from kind of rural Delaware. So two white guys that are deeply plugged in to this movement and this thinking. What would it mean to galvanize kind of progressive, health equity-minded, heterosexual white guys to begin to train them to build these bridges with us? So I have this, fantasy nonprofit called the Daves, or whatever it's really called, where we actually try to bring new people together to think about messaging, communication, engagement in places and spaces where, you don't feel safe or comfortable. I don't feel safe or comfortable, frankly, either. And many so, we need to think differently about who our messengers are, who our allies are, and how to really leverage all of us in this movement.
No, 100%. In moments when, compromise, now I want to go back to kind of something we talked about earlier. In those moments when compromise is necessary, how do you decide what's non-negotiable when it comes to language and messaging?
So I don't know if there's any word that's non-negotiable. I can tell you that I spend so many hours in a given day negotiating words editing and re-editing with my boss and their boss and the team
Right.
and wordsmithing and trying to figure out how do we thread these ever like narrowing eye holes in these needles. It is a real challenge. So I am willing to compromise because I'm committed to getting the
Mm.
message out there, and we've got to figure out what that looks like in 2025 and wherever we're going in 2026. So if there's no words that are non-negotiable, I think what is non-negotiable for me are our processes and our values. And so where I'm not willing to budge is on that process of engagement and the values of engagement. So there's this, if you're not familiar with the National Academy's model of assessing meaningful engagement, they have this beautiful green circle right in the middle that kind of delineates these 10 core principles of authentic engagement. Words like co-equal, equitably financed, shared governance, ongoing, bi-directionality, really multi-directionality in the way that knowledge and expertise flows, etc. And so I'm committed, and I'm not going to negotiate on those core values on how we do this work. So again, it kind of harkens back to the very beginning of our conversation, Corey, where what would it have looked like if academic health systems or public health departments or universities, before they did the scrubbing of their websites, like
Mm.
went to their community partners and said, hey, in a co-equal fashion, we're going to give you our thinking. We want to hear your thinking. We want you to know that we are committed to this process of co-creation together. So let's actually look at the web page on the project that we've been working on for 5-6 years together and figure out these compromises, figure out and negotiate how we telegraph that we're still committed to the values and the process, even if we have to, again, bust out that thesaurus and change our words. Let's do that process. So I think that we can, I want to win. I want all communities to thrive. I want this work in this field to
Hmm.
grow and expand. And so, yep, if I have to strike the word justice and strike the word equity and use fairness instead of just, we'll do that. But let's do that together in a way that we all feel good about and can use that as a vehicle to recommit to each other and to the work.
Absolutely. I want to go back to this connection with community because taking out that the fear that some people had when they started scrubbing out those words because they're fearful of grants being denied or taken away and things like this. So taking that out, there are organizations that do it really well that I know of that when it comes to something they partner really really well with the community, and there are some organizations that quite frankly it's not even on their mind. They
Mm-hmm.
it's just not. um and there are some organizations that want to, they just don't know how or the right way to do it, or who are the key community members to connect with, and all the things.
Mm-hmm.
um can you talk about uh what is that start for someone that, one, why is it super important to even bring the community into something like this when you have some time to really flush it out? And why is that important, and how can someone really start to connect with their community to build a community advisory board or something like
Mm-hmm.
that, to have that relationship, so they don't break that trust?
Sure. So why it's so important, I'll go back to COVID. Imagine a hypothetical scenario where all of our institutions, healthcare, public health, government institutions, have been living their best community engagement life that was based on trust and all of those words that I just said kind of live in that green circle of that model that I referenced, right? Rather, imagine how easily we could have activated that network in the face of a pandemic, in the face of a natural disaster, in the face of a need to actually already have a network of trusted alliances and partnerships that we can pull together to respond collectively, as opposed to something, a natural disaster, an epidemic happens, and we have to suddenly build and scramble to pull new partners in who might be giving us the side A from the jump. So I think, the benefits of authentic engagement really start with stronger alliances and stronger partnerships that then can produce
Mm.
kind of knowledge for everybody. And it's not just top down knowledge. It is not about educating the community. It's also about being educated by the community, right? And then when you do that, your programs are better, your policies are better, and they're more sustainable because there's buy-in on multiple levels, right? And if they're more sustainable and the community had a hand in helping build those policies, those practices, those programs, then there's a way to really embed them, right, into the kinds of organizational, local, state, federal policy changes that do exactly what our goal is: to open up new, fair, and just avenues for opportunity where none existed before. And so I really think that is why engagement is so important. How we start, if you have not yet started, take the time and listen. If you do nothing else, just take the time and listen. Go to places and listen. Don't speak, ask questions and listen. That's fine, right? Break the bread. Listen to everyone, especially folks that we don't necessarily agree with, in service of trying to find that common ground, understanding what their goals are. And so I think that's the most human element of how to start, is just listening and putting yourselves in places and spaces where you're going to hear different messages from different people. You're not putting any expectations. You don't have any asks. You don't have any agenda. You're just there to build relationships for the sake of those relationships. And then over time, right, this work has a long arc, you can build together with those relationships. I think our organizations, the reason that this work is so hard, even though in some ways it's the most human thing we do, right, build relationships, it's so hard because our institutions don't necessarily have the infrastructure or like the organizational culture or practices to make this work easier, right? Things like really pragmatic things, like if you want to bring community partners together and you want to pay them, and you should always want to pay them, right, at the same rate that you would pay any external consultant, right? Are you asking community partners to fill out W-2s and tax forms, right? How easy is it to do that, make that payment? It's really not easy, right? If you want to truly partner with patients or community members on research, how easy does your institutional review board, right, that group that actually approves research studies, do they understand what having a community member as a formal co-investigator is? Do the forms allow for that, right? So there's some real like practical brass tack stuff. Whose job is it at your institution, right, at your organization, to actually build, maintain, and sustain community partnerships in the absence of the grant ask, right, or the service learning, the experiential learning opportunity? Whose job is it? And who's accountable for that work of building and maintaining community relationships, just to have that network without any ask or expectation? So I think that it's both kind of getting in touch with that human place, but then allowing the humans to do that work through institutional policy, practice, and culture.
Yeah, well, they should be definitely paid for their data. And something, and kind of in the same, it's not us seven, one of the vital conditions of health and well-being, but from my experience, when somebody is a part of a community advisory board for something, and they've been asked questions, and there's a pride. People have pride in their community, and there's something like, oh, I'm doing something meaningful and purposeful, and there's a sense of, oh, I am helping my community in this way, and that goes a long way, going back to that trust piece for an organization.
Yep, and you've lifted up a really important nuance, right? So community advisory boards are absolutely one important tool in the engagement trustworthiness toolbox, or actually is one of the principles of trustworthiness, is it doesn't start or end with a community advisory board, right? That's one important element, but it's not just enough to listen. It's actually listen to the input and the wisdom of the members on that community advisory board, and then change and evolve the work in response, right? So it's not just the gathering and the creating a space and a forum for community perspective. It's actually following through and showing and lifting up the really tangible ways that lived expertise has changed and improved the work, and trumpeting that success and giving those flowers to the community to say, hey, look at the changes you suggested and how that's playing out for the good.
Absolutely, absolutely. You talked about building a cross-racial, non-ideological movement for health justice. What gives you hope that such a movement is possible, and where are you seeing kind of early signs of it taking shape?
Yeah, so you mentioned vital conditions for health and well-being, so that's awesome, Corey. So, my first answer is going to be our public opinion polling. So our center does a lot of public opinion polling. And one of our recent-ish polls was on whether or not there was agreement among US adults, so 18 plus, nationally representative sample on all of our polls, that the vital conditions for health, so things like humane housing, reliable transportation, a sense of belonging, a thriving natural world, etc., whether those things were seen as important elements of a thriving community for their own community. And there was universal agreement. Didn't matter how you sliced the data, by generation, by gender, by political persuasion. Everyone agreed that having those fundamental basic building blocks was important for the health and well-being of their own community. So now, yes, there might be disagreements as to whether other communities, quote unquote, deserve those things, right? That's another harmful, pernicious narrative that we have to grapple with. And there might be disagreement, there certainly is disagreement, on why not all communities have those things. But at a very fundamental level, there is agreement that at least my community would benefit from those things. So that's a starting point. But we've done a lot of public opinion polling over our 4.5 years in existence so far that has shown me very surprising areas of cross-racial nonpartisan agreement, right? So it was either 75 or 77% of conservative members of Generation Z said that healthcare is a human right. Well, that's a shocking area of agreement, right? We did a poll on civic engagement, and there was real, again, nonpartisan, cross-party agreement, or cross-ideological. We focus on ideology, not on party. Cross-ideological agreement on things like increasing polling locations, on code of conduct for Supreme Court justices, right? Ways to strengthen our democracy where there is real agreement. Now, I don't agree with all of the things. There was trans-ideological support for things like voter identification at polling. I, Philip Alberti, am not for that. But if that area of agreement gets us more polling places, let's compromise. Let's wheel and deal. Let's figure out how to actually leverage those agreements. And even on areas as contentious as reparations for populations descended from former slaves, there was cross-party agreement, cross-ideological agreement in every state in the Union when we presented policies that didn't talk directly about racial justice or reparation, but just said, hey, here are 7 or 8 policies. We took them from California's reparations report, but we didn't say that. Here are 7 or 8 policies. Do you endorse these policies? Things like increasing funding for public education. Things like increasing public education around voting, increasing opportunities to engage high school students in voter registration, environmental health screenings for all communities. Everyone agreed with those things. So again, the framing really matters. The words we use, to get back to why we're here in the first place, really do matter. So I do want to stress that it's not, the challenges to our language feel very draconian, but there is a nugget in there that the way that we frame and discuss our work and these goals that we do have in common really can either increase support or decrease support. And so I think we need to do some of that work. Sarah Gallist, Dr. Gallist, has done a lot of incredible work. She's a communication scientist, understanding the ways in which you'd be talking about population health equity. She might be somebody great to have on your podcast as well.
Oh, yeah. Will you please come on? I'm looking at you. Come on.
I will help you make that happen. There was this amazing article in The Nation recently about an organization called Community Works. And the premise of this organization is, in a hyper-local place and space, bring together people across political ideologies, across racial and ethnic groups, not for any policy conversation or anything like that, just to do kind of community service work in their community. No organizing, no proselytizing, no soapboxes, just come together and work together for the benefit of where you all live. And that organization has begun to find and have incredible outcomes in terms of energy, enthusiasm, social cohesion, kind of that sense of belonging in place. And so I think creating opportunities for people just to be people together and build relationships outside of political or ideological divisions, that also gives me hope in the potential of these non-ideological kind of cross-racial movement building.
You talk about health justice as both an aspiration and an operational framework. How do we move from aspirational statements to operational realities, especially when navigating the complex politics of language?
I'm going to be a broken record, and so the short answer is going to be community engagement, right? But I'll describe
Mhm.
how we in the center, and I don't know if we talked about this last time, I'm guessing we did, but we kind of define this process of health justice as keeping one foot in community wisdom and multi-sector partnership in order to do the work of the other foot, right? Which is to co-create, again, across community groups, across sectors, the kind of data and story and evidence that can be baked into the policy and practice changes that we've been talking about, right? In order to
Right.
then move towards that goal of all communities thriving. And so I think, one of the mantras in our center is the process is as important as the product. That if we are really committed to that goal, that product of all communities thriving, focusing on this process of health justice that demands, right, the humility to authentically engage with others, with our community members, across different sectors and areas of work in our local towns and counties. That process is both the action and the aspiration.
Mm.
And I think, in response, um, pause, not in response. I'll also that virtuous process, right? That engagement in co-creation isn't just a recipe to achieve health equity, health justice. I think that's how we make progress in any area. And so I think there's a fundamental truth to that engine of trustworthiness and engagement and collaboration that yields outputs that we can't even imagine that live beyond our goal of all communities thriving.
Awesome. Philip Alberti, AAMC Center for Health Justice. Thank you so much for being here with me today. I'm going to leave it right there. I love that. For those that are listening that want to connect with you, learn more about the Center for Health Justice and the work that you're doing, where can people reach out and connect?
That's excellent. Thank you for the opportunity to plug it. They can visit our website at aamchealthjustice.org. A really concrete way to get involved directly in our center's work is we convene a group called AAMC Charge. Charge stands for our Collaborative for Health Equity, Act, Research, Generate Evidence. Kind of a tortured acronym, but it works for us. It gets us to that movement of charge. It's about 1,800 health equity champions from across the country and globe, really. They're about from every sector. There's no barrier to entry. There's no cost. And they are literally the first stop for all of our work. If we're developing a new program, a research agenda, a poll, we're responding to a notice in the Federal Register, speaking truth to federal agencies, we are doing that work in collaboration with members of our charge community. So that's another concrete way to get involved in the center's work.
Awesome. That's dope. I might go sign up myself. I don't know why I
I
didn't do it the first
see you
time.
there, Corey. Yes,
What,
yes.
what am I doing? Okay. Again, Philip, thank you so much for being here. Everybody, I'll make sure I have all those links in the description of the episode on the audio version and on the video, so you can go there, read, connect, learn more, and sign up for a charge. Everybody, thank you so much for listening. This is Corey Dion Lewis. I'll holler at you next time. All right, so that was it. That was my conversation with Dr. Philip Alberti. If you got something from this conversation, I need you to do two things. One, sign up for the Healthy Projects newsletter. You can go to www.healthyprojects.co. That's where we keep these conversations going and share resources you won't find anywhere else. Now, the second thing, if you want to support independent podcasting that doesn't shy away from some tough conversations, then join us at the Healthy Project Plus for just $5 a month. That is literally cheaper than a coffee right now. And it's how we keep doing this work without compromise. The link for that will be in the description. And hey, if this episode hit home for you, share it with someone who needs to hear it, whether it's on your team, your community partners, or that colleague who's been feeling the same weight you are. Share it. I would love that support. We're all trying to figure this thing out, and we're going to do it together. Again, my name is Corey Dion Lewis. I'll holler at you next time.